Hello everyone, this is Dr.Manjunath, consultant urologist and andrologist at NE Urogynec Clinic and Navodaya Medical College, Raichur. So basically today I'll be talking about urinary leak. So patients come to my clinic saying, sir, I am having leak when before I pass urine or when I bend or cough, sneeze. So basically we have to understand there are three types of urinary leak that we commonly encounter in clinical practice. We call as incontinence in medical terms. So these patients have, one is urinary urgency leak or urgency incontinence, stress urinary leak or overflow incontinence. So these are the broad terminologies where we describe. So in this video I'm going to tell about the causes and what are the remedies, how the patient presents in simple common man language. So first thing is something called as urgency leak, meaning when the patient has to void, gets the sensation to void, before he goes to the bathroom, he will not be able to control urination for maybe 2 to 3 hours. Generally, we can control urination for 2 hours, sometimes 4 hours also, right? So these patients will not have control. They frequently have to go to urination and sometimes associated with leak. Before the patient goes to the bathroom, he will have leak in his innerwear or pants or whatever. So these patients, the causes are generally local causes like infection, cystitis, sometimes stones, okay, and one terminology called as overactive bladder, meaning the bladder that has to contract during the act of passing urine will sometimes do overactivity. The muscle becomes overactive, means more than required, the muscle does its action. So that is called as overactive bladder. So we have to understand and diagnose these patients with the clinical suspicion and also few investigations that a urologist will need. So after doing all this, so generally they are treated with reducing the stress levels of the people, and then also we give something called as bladder relaxants, means the contractility of the bladder will be reduced by some drugs. Over the time we use these drugs and eventually we have to stop it. So next is stress urinary leak, stress incontinence, meaning whenever there is increase in abdominal pressure, be it because of coughing, some patients bend and have a leak, some patients when they try to strain to pass stools, they have a leak. That is called stress urinary leak. So this is usually seen mainly in women because the urethra, that the pipe that carries urine from bladder to outside, that is very short in females. There will not much of resistance, unlike male we have prostate organ. So in females all that is not seen. So these patients usually have stress urinary incontinence. So again for these patients, basically it's a social taboo because the patients will have leak and then urine smell will be there. People around the patient may not like the smell. So these are all little bothering kind of symptoms, not life-threatening situations. So what we have to understand in stress urinary leak is we have to first understand the diagnosis, then plan any surgeries. Before surgeries we have to do conservative management in the form of weight reduction. We ask the patient to avoid coffee, which is again form of diuretic. So something called as pelvic muscle strengthening exercise, we call Kegel's exercise. So that exercise has to be done in order to strengthen the pelvic musculature in females especially. And lastly, there is something called as, we put tape in the urethra part, tapes, transvaginal or transobstetric tapes we put, so that the whatever support that is lacking in the urethra gets they get it from the tape. So next thing is overflow incontinence, meaning the bladder becomes full because there will be something called as bladder outlet obstruction due to various causes, be it stone, prostate or any stricture or any other form diagnosis. So basically the outlet will be obstructed and hence the urine keeps on storing in the bladder and over the time it starts leaking. That is called overflow incontinence. Basically like how we have overhead tank where we through the pump we put water in the overhead tank. Once it's full, it starts leaking, right? So same thing happens within the bladder also. So these things are very well managed, diagnosed and managed in when we go to urological consultation. So people with urinary leak, do not hesitate, please consult a nearby urologist, and definitely there is remedy for all these kind of leak. There is no need to suffer socially as well as some patients come with all rashes or because of leak and they have perineal rashes and all those things. So all this will be taken care by a urologist. Thank you so much.